My background is public health, and I spent a lot of time examining the systems and how they contribute to health disparities and why there are inequities across, particularly race. And so I got involved with environmental racism because I realized the environment has a direct effect on health disparities. And so when I really kind of mastered public health, we're still learning and growing, but I understood public health. I just discovered environmental racism and the role it plays. So I dove into that and got more specific and into that space. But I said, you know what? There are people in this situation that are contributing to the unsustainable practices that are contributing to environmental racism and or health disparity. So I challenged myself to go learn more about sustainability because I'm like, I don't even know how to talk to people that are actually creating the issues. I get that they're potentially contributing to the crisis, but I don't know how I would enter a space I'm not familiar with. So I just went out there and said, you know what, Amari, I'm going to figure this thing out. And I went back to school and because I have too much time on my hands, got a second master's in sustainability. And I do not regret that.
Welcome to Public Health Careers. I'm your host, Omari Richards, founder of the Public Health Millennial. We're going to dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies, get tips, while also learning from others to help you in your own journey and learning of public health. Learn about the vast world of public health careers, or just hear public health stories. Stay tuned so we can do our part towards a culture of health, well-being, and equity for all. Hey friends, welcome to Public Health Careers. In today's episode, you'll hear more about the intersection of environmental racism, sustainability, and public health, the benefits of having a clear understanding of what you want to get from a master's program, as well as starting a consulting company to first focus on inclusive excellence and then shifting towards sustainability and working with Fortune 500 level companies. If you enjoyed this content, all I ask is that you hit that subscribe button, leave a review, and share this with someone who can get some value from it. This is really the best way for you to support the show getting out to more people, so be sure to subscribe, leave a review, and share it with someone. I greatly appreciate that. And okay, well, now enjoy the show.
Hi, my name is Crystal Dixon, and I work at the intersection of environmental racism, sustainability, and public health. I am the founder of Mango Consulting, and you're listening to Public Health Careers.
Today, we have someone whose academic research and scholarship explores the intersection of environmental racism, sustainability, and public health. She conferred a Bachelor of Science in Health Education and Promotion, Community Health at East Carolina University, then got her Master of Public Health in Health Analysis and Management at the Brody School of Medicine at East Carolina University, before working in several roles. She then went on to get a Master's of Arts in Sustainability at Wake Forest University. She currently works as an Associate Professor of the Practice, Health, and Exercise Science at Wake Forest University and is the founder of Mango Consulting. We have Crystal T. Dixon, MPH MA. Welcome to the show.
Thanks, Amari. I'm glad to be here.
I'm glad to have you. I don't get to interview many people that are in this triad region of North Carolina. And since you live in the triad, you probably know what that is.
Yes.
Many people do not.
Yes. Glad to be here.
My pleasure. I'm happy that I get to dig more into your story. I'm very excited to hear more about the Masters of Arts in Sustainability and how that came along in your journey, because that's not something I don't think I've had anyone talk about on this podcast before. So I'm very interested in that. But before we get into anything, how do you identify?
So my pronouns are she, hers, and I'm a Black woman.
Awesome. And before we get more into what is public health to you and your collegiate journey and getting into public health, talk more about environmental racism, sustainability, and public health.
Sure. So my background is public health, and I spent a lot of time examining the systems and how they contribute to health disparities and why there are inequities across, particularly race. And so I got involved with environmental racism because I realized the environment has a direct effect on health disparities. And so when I really kind of mastered public health, we're still learning and growing, but I understood public health. I just discovered environmental racism and the role it plays. So I dove into that and got more specific into that space. But I said, you know what? There are people in this situation that are contributing to the unsustainable practices that are contributing to environmental racism and or health disparities. So I challenged myself to go learn more about sustainability because I'm like, I don't even know how to talk to people that are actually creating the issues. I get that they're potentially contributing to the crisis, but I don't know how I would enter a space I'm not familiar with. So I just went out there and said, you know what, Amari, I'm going to figure this thing out. And I went back to school, and because I have too much time on my hands, got a second master's in sustainability. And I do not regret that.
That is like extremely awesome, and I love the idea of I don't know how to talk to people about this topic that I'm interested in, but I know that it's a topic that's important. So how can I get more information on it so that I am able to speak to them about that? So that's really good perspective.
Yeah, Omar, because you know what? It's like you cannot make change without understanding the language of your audience. And so I was like, oh my goodness, I have to figure this thing out. I also was genuinely interested in it because I realized we are in a climate crisis and the unsustainable practices are what's contributing to the crisis. And so while environmental racism is one result of that, the source of the crisis is unsustainable practices. So I learned so much, and I want to shout out to Dr. Stan Myberg for giving me the opportunity at Wake Forest because he was actually the regional EPA, I believe, administrator in his past career. So it was awesome learning under him.
And it is so true that you highlighted the climate crisis and how the unsustainable practices and many times unethical practices are what have gotten us to this point right now. And it's very interesting that we don't talk about this climate crisis as much as like we need to, because I think there needs to be action, maybe like starting yesterday, last year, maybe a decade ago. But
Mhm.
here we are today, and I'm glad that you and other people like yourself are working towards advocating for these issues and creating solutions to these issues. So I appreciate the work that you're doing.
And Amari, I say one more thing. There aren't a lot of Black women in the sustainability space. And so I realized that I wanted to change that. I wanted to actually normalize in diversifying that field. So there that comes with some challenges, but I've been met with nothing but open opportunities because of that.
Love that. Representation matters.
Yes,
Representation matters in all spaces. So
that's right.
before we get more into your bachelor's degree, what does public health mean to you?
Yeah, public health to me is advocating for the equitable distribution of resources and opportunity for all. Everyone should have an opportunity to thrive. And unfortunately, people do not. And so I think having an opportunity to have access to everything you need to actually thrive to your fullest potential to me is public health.
Love it. Very succinct and very informative at the same time. So
Yes,
you got your bachelor's of science in health education and promotion, community
hmm
health at East Carolina University.
I
What was the
did.
thought process going into there?
Yeah, well, first, go Pirates. And yes, thought process. It's interesting, Omari. I went in because I wanted to, like most ambitious college students, I wanted to change the world, right? And I still do. But at the time, I was thinking about maybe going the nursing route. Then I went to the pre med route because I said, I don't want to actually prevent people from dying. But then I realized pre-med, while there's an important aspect of that, they're more on the diagnostic, on the end game. Like how can we manage the condition you received? I wanted to prevent it. So I shifted my focus to public health because I didn't know it existed. And when I stumbled across it, I had a paradigm shift because I realized after watching Unnatural Causes, believe it or not, it described how systemic racism has a direct impact on the infant mortality crisis and maternal crisis. I said, oh my goodness, this could be prevented. I've got to change my major. I've got to go into public health. And I did that. I left the class. I went to the advising center, said, I'm changing my major. I was all bold about it. And I have not looked back since. And so it's been awesome because prevention is economically advantageous for many reasons, but also it's just public health through and through is all about prevention. So I'm glad I made that change.
I agree with that. So what was the thing that sparked you to want to take up public health during your bachelor's degree?
Yeah, when I realized that it wasn't about your behaviors and your decisions only that created health disparities, when I realized it wasn't about the individual's fault, that systems were actually playing a role in what we're fighting against, I was like, oh my goodness, I've got to be part of this fight to fight these systems. And so I only fight the systems because the systems are what's creating the inequities, not the individuals. Yes, we're making decisions that are bad here and there for our health, but by and large, you can make every right decisions, and the data show that you're going to have a different outcome based on how you present in this world, based particularly on race. And so I was really enthralled with that because I said, wow, your race could determine how you live in this society even if you do everything right, if you control all variables, all the research I've controlled all variables to show race is the number one predictor for your health outcomes. And I had to do something about that.
That is drastic, and I like that a lot. And I have a very similar story in wanting to go of like wanting to change the world, wanting to be
Yeah.
pre-med medicine, and then learning
Yeah.
about like this the systemic inequities, and just understanding that the band-aid solution of our sick care model just isn't going to get to the root causes of addressing those inequities. So I appreciate that, and definitely resonate with it as well.
That's awesome.
And during your bachelor's degree, you were an intern at the Greene County Healthcare Incorporated, and you were hired into this position after your bachelor's as well. But tell us more about that internship experience.
Yeah. Well, honestly, I was really interested in getting an internship because I was in Eastern North Carolina, which is very rural, and I wanted to go into deep into that experience to learn more about the inequities impacting rural communities. And so that was a federally qualified health center where I was at, and it gave me the direct experience working with immigrants and refugees and people of color and people Black and Brown communities that were all low wealth and were looking to have access to healthcare. And that's where I wanted to be. I wanted to understand how we can help provide safety nets for those individuals. And so I landed that internship, which turned into a job. And if I had any takeaways from that experience, I'd say never accept an offer based on an hourly rate. I was making like $10 an hour back at the time for an intern, which is great ish. But then when I got hired, I think they only paid me $5 more per hour. I was like, yes, I'll take it. And I literally could barely live, and I had to decline benefits, to survive. I was like, what? So basically, you just want to make sure that, you're negotiating and it makes sense. You know what you're worth, what the going salary is for the position. But also another experience I'll say, a takeaway from that is I was placed at another internship that I was not a good fit. And one of the things I'd say that I remember about that was I was so devastated about the circumstances. I went directly to like the head and told them this is not a good fit for me. And you should never do that as a student because you're going to burn a bridge. And so that was just a big takeaway for me because it caused a whole bunch of issues later. But I guess I'm going on a tangent with that. But I will say that I enjoyed that because I was focused on diabetes. I worked with diabetes, and I helped those particular patients who needed the support get access to like programs that provided free insulin because insulin's ridiculously high, access to courses, just anything they needed to thrive. And I was just like, goodness, this is a great space for me. So that's how I got involved with the internship, which turned to a full-time job.
Okay, that makes sense. And I didn't know this, but North Carolina has the second biggest rural population in the U.S. behind Texas.
Wow.
Which yeah, I didn't know that, and
don't
I
think I knew
work in
that.
North Carolina, and
Yeah.
a lot of my work is in those rural regions in the eastern parts of the state, northeast to be specific. So
Yeah.
I definitely probably understand a lot of the similar populations that you were able to work with and interact with during that time. But I wanted to ask
Absolutely.
more about that position that you said you weren't a good fit for, and you said you approached the situation in a way that you probably, in hindsight, wouldn't have done. And I
Yeah.
think it's very important. There's a very important point because a lot of us, especially when we're young in our career, we're just trying to get like experiences and better understand where we fit into public health, whether this is something we like, whether this is something we don't like. And I think both of those are really good to understand and to know while you're developing. Yet when you are in an organization and it's not a good fit, it probably isn't the best to, as you say, like not to go up to the person there and say, hey, this is not a good fit, get me out of here, and potentially burn that bridge more likely than not. So
That's right.
looking back on that situation, what would you have done differently, or what would you advise someone in that type of position today?
If you're referring to the just the internship that I liked in general, I would absolutely look to see what the going salary is for the position you're being offered. A lot of people will offer you the best option that saves them money, and you won't know it because if it's your first job, you're like, oh my goodness, yes, let me take whatever you have. And then you end up getting the short end of the stick. So definitely never accept an offer on the first offer. Always negotiate and know what you're asking. That's the biggest takeaway. Also, don't be afraid to take the initiative. I took this job and I got the opportunity to create my own physician. Like I literally was like, they're like, hey, we need someone to educate people on diabetes. However you want to do it, you do it, just as long as you meet the goals. And so I was like, oh, this is daunting. But then I was like, wait, this is actually great because I'm free. I have my own office. I have my own, so don't be afraid of taking opportunities that aren't like cookie cuttered out for you, because it allows you to stretch as a professional and also allows you to discover your strengths.
Absolutely agree with that. And before we talk about, I guess, the shift from internship into full-time position and like what that entailed on the professional side of things, did you have any bigger undergrad takeaways that you wanted to share with everyone?
Oh man, undergrad. Yeah, I think undergrad, I would absolutely live on campus if that's helpful, because you learn a lot about people, and you have to be able to navigate people when you're going into these professional spaces. People are not always going to be easy. Some people are difficult, and instead of running away from difficult people, learn to navigate them, right? So I think undergrad helps you expose you to just a cadre of diverse people that you can learn to navigate. Staying on campus is important. Also, don't be afraid to connect with your faculty and learning about their connections, because a lot of faculty, me being faculty now, I understand have a lot of relationships they've built over the years that can benefit you. So building relationship with faculty is important for those who want to be in a relationship with you, of course, is key. And I think faculty will remember that when opportunities for jobs come up. So it's really key. It's one thing I wish I would have done a little bit more. I have one professor that I built a great relationship with to this day, but I don't think I did enough because I was a little shy. But faculty are looking for that. So I encourage most students to do that.
Thank you. So after you graduated, you spoke about transitioning from an intern at the Greene County Healthcare Incorporated to a chronic disease case manager, full time
Hmm.
position, where you say
Hmm.
that you probably should have advocated for more pay or like a salary job. But outside of that, were there any big shifts in life as a professional, or like what was that jump from like being an intern to actually working in a full time position?
Thankfully in that position, Omari, it was I was an intern, and my duties didn't really shift that much because they were hired me full time as an intern, just full time. But got a position. I will say that I was on my own. I was a little bit more assertive because I actually had a permanent position. I was attending meetings and understood how the federally qualified health centers operated. I was able to tag along people to learn the ins and outs of, you know, I think it's patient centered homes. I can't remember the acronym of how they move, how they operate in those spaces. But I also had to become creative. I had to meet these goals on my own, and I also was like, man, I don't know enough, which is why I actually went on back to school. But I really what it exposed me to was what I didn't know. I was like, oh my goodness, this is an amazing job, but there's so much gaps. I just had so many questions, Amari. I was like, I need to go back to school to figure that out. And so it was certainly served as a great launching pad into public health.
And that plays right into my next question. So you got your master's of public health in
I
health
did.
analysis and management at the Brody School of Medicine at East Carolina University. Was there any other process of thinking of like choosing this as a school, or like just getting a master's of public health outside of like just being in that role and understanding that there was so much that you didn't know and you just wanted to learn more about the field of public health and how you can impact it?
Yeah, Omari. So when I was an intern or actually working full time, I remember this is how it started. I was going to lunch, and I realized when I was going to lunch in Greene County, I was like, there's just not a lot of options for me to eat. And if there's not healthy options, and if there's not a lot of healthy options for me to eat, I can only imagine what my patients are struggling with, particularly my diabetic patients. Then I realized, wait a minute. So who makes the decisions to put the McDonald's and Wendy's here? Why is it just in this black and brown community? What are the decisions that are behind this? What systems are at play? So I had all these questions, and I said, I have to go back to school to do that. And because East Carolina, although I was an undergrad, happened to be based in rural North Carolina, and I knew I was already in a job there, I said, well, this is a great, transition to a school who values rural health. And so I applied, and several of my undergraduate faculty recommended it as well. And I had a lot of respect for the faculty in the graduate program as well. And I went on, and I was so glad I did, because it was all the questions I had, Omari, about zoning ordinances, policies, systemic racism, systems, the role that they play, and the inequities I witnessed during my lunch breaks were all answered in my MPH program. And so I was armed with that degree because in the irony of that is when I went back to school, we took a class trip back to my job. Weirdly enough, I was like, oh, this is awkward. But it was certainly insightful because, I was like, oh, I was here before. Now I'm coming back more knowledgeable of the issues I recognize as an intern and a full-time employee. So yeah, that's why I went back to school, because I had to figure out what was going on and all the inequities that I was noticing in Greene County.
And I just want to highlight the point of you like knowing the kinds of questions that you wanted to get answered, and just like, okay, what's going on with this zoning ordinance? How does that work? And going into the master's program prior with that kind of like, okay, these are the things that I need to get out of here, as well as probably all the other foundational knowledge that you are getting. And it's great to hear that you were able to get those experiences, as well as I like the point of choosing a school, like knowing that you want to work with rural communities, and then choosing a school that is based in a rural community that does a lot of work with rural communities is definitely something that people should think about as they're thinking about developing their public health career.
All right. I was going to say also, I think that's why it's important, because you're right, to get experience first. It's good to go all the way through, but there's just a little bit of a different passion and fire that's lit under you if you go out there into the community and see the issues, and you go back armed with questions to figure out how to solve the solution. So yes, that was a huge advantage for me, and also getting accepted. They really value people that have experience first. So anyhow.
That's so true, and it gives you just more to speak about on those personal statements and different things like that as well. So it definitely is beneficial, as well as you get that work experience that I think is also helpful in just taking like concepts and making them more tangible, or like real life, and understanding that some about the public health field and the work that is going on there.
Mm-hmm. That's right.
And while you were in your MPH program, you had quite a few different internships and positions. I'll just name them out, and I'd love you to go through and maybe share some like high level takeaways from these positions. So you were an intern at UNC Center for Health Promotion and Disease Prevention, and then at East Carolina University, you were a graduate research assistant at the Brody School of Medicine. You were a graduate assistant for the Center for Health Disparities Research, and you were a graduate teaching assistant for the Department of Health Education and Promotion.
Yes, Omari, I just had so much free time. What it was, I was trying to survive. I was like, I need another check. I got to pay for it. But no, really, I was just so enamored with all the opportunity that East Carolina offered. I'll start with at UNC Center for Health Promotion and Disease Prevention, or HBDP. I think you're at UNC, if I'm not mistaken. You had some experience, or you're grad, right? I think.
Not of UNC, of Florida, University of Florida.
Okay, I apologize. Okay, yes. But yeah, and so I was as an intern there, I believe I was on the Seeds for Hope project. And a takeaway for that is I was able to go out into the indigenous communities and learn more about their experiences and their disparities as related to, I believe, obesity. And so I was able to learn data analysis. I had to figure out how to do SAS, a whole bunch of things, that high level data analysis at UNC that experience, which offered me a great connection I made there who I'm still connected with today. But as far as East Carolina University, as a graduate research assistant for the Brody School of Medicine, I was able to collect data from like about 100 supplemental nutrition assistant program, or SNAP, participants. So I was able to get data on those who are on SNAP. I had data entry and coded it and all that. And one of the things I learned about that was what zoning ordinance was. So I mentioned earlier, wow, what are the roles that zoning ordinances did? In this particular opportunity, under Dr. Stephanie Jocott Pitts, she taught me the impact of zoning ordinances and health disparities. As far as the Center for Health Disparities Research under Dr. Essie Torres, she was fantastic. She's my mentor today. And she was my first experience before the one with Dr. Jocott, but she was my first experience publishing my first paper as a graduate student. And so that was exploring breast cancer and how it affects African-American women in Eastern North Carolina. And why were they getting breast cancer and others weren't? And so we were to dig into the specifics of systems and how it played a role in that. And I was able to do qualitative data analysis and things of that nature, and doing IRB and stuff that I never understood. And so these opportunities as a graduate assistant allows you to get your feet wet and say, oh, that's what that means. That's what that process is. Oh, that's what that training is. And so then you're not so green going into school because you learn the processes early on. I submitted my first abstract to Research and Creative Achievement Week. We got accepted and it was fantastic. So there's a lot of things you take away from that. And as far as the graduate teaching assistant for the Department of Health and Education and Promotion, I just taught a health class. I taught Health 1000. And I presented over 20 lectures and worked with a host of students there as my first teaching gig ever was at East Carolina. So all of that fell into my lap because I was having relationships with people that I met as an undergrad, going into grad school. So relationships are everything. And I also approached Dr. Essie Torres. I approached her and asked her, can I work with you? And these faculty have grants and opportunities to pay you to do that. And they don't know your interest until you ask them. So I encourage students to start reaching out to faculty that they admire to work with them. And if they can have the capacity to do that, I guarantee they'll take you on.
Absolutely. That's a big key there. And I think it's even more helpful to think about when I'm applying to this school, who are the faculty that I might potentially want to work with, and reaching out to them and having those conversations even beforehand. But to your point, a lot of times faculty members do have grants, and they are looking for assistance in getting, like, whether that's research or someone to help with write-ups and different things like that. So it is an onus on the students to reach out to those faculty members that might have interesting projects or work in fascinating areas to yourself, so that you are able to learn more about those processes and maybe do an IRB, which is so much fun, and all the other things around research and data.
Yes.
So were there any big takeaways I wanted to share about your MPH program?
Big takeaways, man. That's a great question. I'd say value every course. I mean, statistics, for example, I went in, here's a takeaway. Go in knowing that you can do everything. Go in knowing that you can actually perform well. I took a biostats course and I went in just fearful of my life, Amari. I was like, oh my God, I'm going to fail. I'm going to fail. I haven't even tried. And the first exam, I actually did fail, but it wasn't because I couldn't do it. It was because I went in with the mindset I couldn't do it. And the next exam, I got an A and I went on to be successful in the course. But the truth of the matter is, don't go in afraid of what you don't try. Go in with a winning mindset and you'll do great. Faculty there want you to win. They want you to do well. Take advantage of the office hours. Ask the questions you want to ask. Don't be afraid to challenge anything you hear because you want to make sure that you're understanding it. And so that's my takeaway is don't be afraid to ask questions. Don't be afraid to reach out to people who are going through the program with you because they're going to I have lifelong friends today. I'll mention a few, Leah Mayo, who's doing incredible work in North Carolina, Michaela Penix, who we stayed in contact, and even Dr. Lorenzo Hopper, who was a graduate from UNC. He's at UNC Charlotte. So we are all still really great friends because we went through an experience together. So recognize you'll meet people that'll change your life. And I'm currently working on a project right now with Leah because of our relationship. So that's my takeaway with grad school.
Yeah, great takeaways. So after you graduated with the MPH, you became a public health education specialist at Durham County Government. Before I ask about that, actually, so you said going into your MPH, you had these questions that you wanted answered. It seemed like you got most of them answered. Would you say you got everything that you needed from the MPH program?
I would say so, Amari. I think those faculty there were extraordinarily bright. And they were able to provide wisdom and perspective because they played roles throughout the course of their career. Dr. Eric Bailey, I have to mention, he's over a certificate program there. He was I can't believe I'm blanking on his name, but what he is, but he's fantastic in the role that he plays. And so you get access to people's history of work in that experience so it can be applied. You can understand it's not so theoretical. Right. So what's great about it is they can apply practical experience to theoretical concepts. And so because of that, I was able to actually walk away with some fantastic insight as relates to things I was observing as an intern and a full-time employee.
Love that. Practical insights to theoretical perspectives, something around those lines. But yeah,
Yes.
again,
Yeah,
practical experiences
that's
on the
right.
theory. Because yeah, in your MPH program, you are hit with a lot of theory, and I think that goes back to the point of like having some rules that you can relate the theory to actually think about this in a real world sense, or like getting projects where you're able to actually like use this in a real world sense in a public health real world scenario, which I think is very, very helpful.
That's right. That's exactly right.
Yeah. So you, as I was saying, you got your public after you graduated, you became a public health education specialist at Durham County Government. So how do you come across that, and what do you do in that position?
I did, Omari. That was one of my favorite jobs. Let me tell you why. I went to a conference in Greenville, and this is great advice right here. Okay. I went to a conference in Greenville, and I went to, like, they had a breakout session. I went to go hear about it, and I saw Durham County. They were talking about the Healthy Mile Trail, and I didn't know what that was. And I'm listening, and I said, "Oh my gosh, Durham County is doing incredible work. How can I work there? I have to work there." Omari, I walked up to the presenters and said, "Hey, I want to work here. What do I need to do?" And I'm just kind of bold forward, like, "Whoa, we don't have any postings." But the lady there was like, "Hey, you know what? We're posting a position for me. I'm actually leaving. We're going to post it in the next couple of months, or next couple of weeks rather. Just keep checking our website and apply." Omari, it was Thanksgiving Day. Turkey just came out. I got the email that that job was posted. I jumped out of the table and I ran upstairs and I applied. I said, "Forget that turkey. I'm getting a job." You know what I mean? So, and guess what? I got the job. So you have to know what you want. If you know what you want, go after it and get it. And I'm not saying it wasn't competitive, but I will say that I knew I needed to be there because I was going to be working in diabetes, working in underserved communities, particularly in low wealth project housing communities, to educate them about diabetes because there was such a high amputation rate. There was such a high percentage of people walking around with diabetes who didn't know it. And I said, that is where I need to be. And so I had to be ready, Omari, and I did it. And so that job, oh my gosh, that was a great experience. But that's how I got the job.
Okay, that makes a lot of sense, and I think like to that point is making people know that hey, this is something interesting to me. I want to work here. I want to do a project with you all, and even if there aren't those opportunities, people see that you're looking, they
Yes,
open them out and they share information that might be helpful. And
that's
then
right.
to your point, you can always buy 100 turkeys when you have a job, so you don't have to worry about that one turkey. Um,
That's right, Omar. You know what's crazy? That year was 2014. I got the job in April 2014. I graduated April 2014, and I got married August 2014. So that year was crazy. I was like, "Oh my God, this is my year." So it was incredible. But yes, you got to be ready.
Awesome. Well, shout out to 2014.
Yes.
And after this position, you became an adjunct instructor at North Carolina Central University. So tell us more about that experience.
Yeah, so I was still full time at the Department of Public Health at Durham County Department of Public Health. I was still an employee there, and I was just tapped to come teach part time. I think they felt I offered something for the students there, and at the time I hadn't taught anything other than chronic disease classes and maybe a smoking cessation class or two. I was doing a lot of those actually, but that was an opportunity that fell in my lap because of my supervisor at the time put in a good word for me, and I was excited about the opportunity. And so I taught there probably a semester or maybe two, and that was my first experience teaching personal health to about 100 college students. And so that was great to get an HBCU experience because I hadn't had it yet as it relates to teaching. I've taught in East Carolina, but I didn't teach at any other university at that point. So that's how that happened. And yeah, so Dr. Saranda Robinson, who was the chair at the time, was super supportive in that opportunity.
That's cool to see like you're doing this job and this like, oh, this person has some value that they can bring to these students, as well as
Yes.
like it's helpful to you to like be able to be in that HBCU context, which is different from what you have had before, and be able to like learn from the students as well as teach them information, which is awesome.
That's right. Because you know what? I said, people have to learn what I'm doing. I said, I have to be able to pass this information forward to the next generation or whoever coming behind me. Because if not, why wouldn't you? And that's why I was always interested in teaching, because I wanted to be able to take the things I learned and apply it to students' learning experience. So that was a great opportunity.
Yeah, we appreciate that, and we need teachers, and we need good teachers. So I appreciate
Sure.
that. And
Absolutely.
after this, I guess both of these roles you became, or maybe it was during, you let me know. You were at University of North Carolina at Greensboro, and you had three positions at the school. So you were assistant professor, public health education. You were chancellor's advisory committee on equity, diversity, and inclusion excellence, and
Mhm.
you were on the School of Health and Human Sciences racial equity task force. So I guess I was one position and the different like task force advisory committees. So
Right.
tell us more about those experiences at UNCG.
No, you're right. So a friend of mine that was actually at Central with me told me, "Hey, Crystal, there's an opportunity at UNCG. You should apply." I said, "Really?" I was like, "See, Omari, I was thinking if I was going to be a professor, I had to be. I was like, maybe when I'm 50, when I'm just coming down the hill, I'm going to just kind of ride off into sunset teaching." But this opportunity fell in my lap when I was probably about 27 years old. And so I was young and I applied anyway. I took the chance because, again, I had a little experience at Central, but I also realized I want to get into the public health curriculum. Where I was at Central, I was in their I was in the public health education department, but I wanted to do it full time at a UNC Greensboro. And so I got the job, which was amazing. And when I got there, you get your feet wet the first 2 years, it's tough. When you're teaching for the first time on your own three classes, let anyone lie to you, Amari. It is hard. But when you have great students, you have great colleagues. I have friends to this day that are still in the department. It became easier. You learn. But because of I suppose my approach and reputation at the university, I was invited to join the Chancellor's Advisory Committee on Equity, Diversity, and Inclusive Excellence, particularly with the wake of George Floyd happening. They also formed the School of Health and Human Sciences, formed the Racial Equity Task Force. So I was part of that. And I also was the chair. I didn't mention that to you, but I was the chair of the Diversity, Equity, and Inclusion Committee, the first to ever be voted in as an actual committee. I believe it was an ad hoc committee, but wasn't in the bylaws. So I was able to get that passed as the chair, co-chair at the time, which I became the chair, and passed that, which stands today. So I did a lot of diversity and inclusion work because systemic racism is also actively present in higher education. So as you know, when people go up for promotion and tenure, there's going to be a difference between who gets promotion and tenure. We saw a lot of that with Dr. Nicole Hannah-Jones at UNC Chapel Hill is a national example of that. And so we deal with that a lot across universities. And I'm not to say UNC Greensboro was supporting that climate, but they recognized if it did exist, they wanted to do something about it. So I led in those particular spaces. And I'll say one last thing. Before I left UNC Greensboro, which was one of the hardest things for me to do, was I created an online implicit bias course for the entire School of Health and Human Sciences under Dean Carl Matacola for all the tenure and promotion committee to take before they review packets for promotion. So it allowed to kind of interceded the implicit bias that may exist when you're looking at Black and Brown faculty going up for promotion.
I love that. Creating a tool to be helpful to ensure that there is inclusivity in the choices that are being made. And correct me if I'm wrong, this is what led into you creating your consulting company, Mango Consulting, where
Yes.
your approach is to systemically integrate social responsibility and environmentally friendly practices through guided dialogues grounded in evidence-based truths. You help teams discover. So tell us
Yeah.
more about creating this to
Yeah.
then wanting to create a consulting company.
Sure, Mari. So I started off, I had a lot of requests with diversity, equity, and inclusion. We would work with the UNCG online. We worked with organizations in the community, and I was becoming higher in demand. So I said, well, let me go ahead and set up my actual business because I've been wanting to do it for a while. So I started off in inclusive excellence. And then since then, I have shifted dramatically to sustainability. And so I bring in inclusive excellence, sustainability, and public health together because all of them coalesce to impact public health, right? So at the time when I started Mango, it did focus on DEI, which I still offer those services, but I'm really primarily focused on sustainability and helping corporate companies discover a sweeter way to work. And so, and that's where that came. And so, but that opportunity, creating the course at UNC Greensboro, was my first opportunity to do that. Although I did that as a faculty member, I launched after that to begin taking on other projects through Mango.
Tell me more about that. So you started off in this DEI space, in this inclusive
Mhm,
excellence space, and then you later shifted to the sustainability.
mhm.
Was that a result of the master's program that we're going to talk about in a bit,
Mm.
or was this a result of something else? Like what caused that shift for you?
Yeah, that's a great question. So, yeah, I began to grow increasingly interested in environmental racism and sustainability in public health after leaving UNC Greensboro. And so I had recently, I believe I graduated in 2020, and I believe I had maybe 2021, I can't remember, but I left the same year. And so I was able to focus increasingly on that topic. And so again, while inclusive excellence is still what I offer, I wanted to merge inclusive excellence as it relates to sustainable practices and environmental justice and public health. And so it's still there, but the focus is because, like you said, of that. And I would say one last thing: while I was in the graduate program, I was able to be a co-designer for a give back recycling project at the Rest Rock, company, and they gave me great insight on what it means to pitch an idea to a I don't know if they're Fortune 500, Fortune 300 company, who's focused on sustainability. So WestRock, they're the ones that do the Domino's pizza boxes, and they're very sustainable boxes, and so they're the supplier for that. And so I was able to learn more about the role of unsustainable practices and inclusivity. And so I shifted that, Omari, because of my experience, yes, in the program, but also realizing the major role that they're playing in the disparities I'm fighting.
Okay, that's great. Well, not great to hear, but great that you're
Sure.
doing that. Great that you're doing that
Absolutely.
work, and definitely awesome. I think it's always awesome to hear about people doing environmental justice stuff, especially in North Carolina, since many people don't know, but North Carolina and Northeast North Carolina, Warren County to be exact, was the
Mhm.
birth of the
That's right.
environmental justice movement. And I met a lady who got arrested from that movement. I was having some dinner
Wow.
with her a couple weeks back. It was really cool, and just to hear her perspective on that, and like they were just trying to do it because they wanted to help their community, not for anything bigger than that, and it just turned into something bigger. And as we've seen the environmental justice movement grow
Mhm.
worldwide, it's really awesome to see.
That's right.
So I want if you don't mind, what are some of those things that you said? Westrock, who makes boxes for Domino's, helped you think about, like, how do I pitch to these larger Fortune whatever organizations? What are some of those key things that they mentioned to you?
Yeah, I'd say the concept, you have to be able to you have to be able to what's the word? I'm thinking of the I cannot think of the process we use, but you have to be able to simplify your idea in phases. I cannot think of the process right now. It'll probably come to me later, Mari, but I've learned that you have to be very clear. You have to have a vision. You have to have how this affects the bottom line and why they should care. And because at the end of the day, what I care about, companies aren't going to care about if it's going to, particularly if it's going to cost them money. So, what my biggest takeaway was in the program in general, even though WestRock was part of that, was how can I create a compelling argument to become more sustainable that's going to actually increase profit margins and also improve reputation and also improve their product. And so I learned that and the language to use and what that means to be sustainable, carbon emissions, carbon neutral, what it means, you know what I mean, to be eco-friendly. And I understood the role of that because people think you can wake up and go to a company and say you need to be different. No, they need to understand, well, what's in it for me? What's the return on investment? You have these green giants like Chipotle and Coca-Cola and IKEA who are known for being sustainable because of their base. They know that their consumers and their stakeholders want that. And so I learned how to navigate in that space, and I'm still learning. But that's the takeaway for me from the program.
I think that's very insightful because, as you said, many people in public health and just in like social justice movements in general are like, change your organization, but many many times, to your point, it's like they're gonna say no, and they have the resources to, like,
Exactly.
essentially not really care about what you're saying, unless like, to your point, it's like, where is there alignment and space for partnership for both of us to prosper in this in one way or another.
Omari, you're right. I was just before we started chatting, I was actually watching Global Citizen today is having a massive initiative happening right now in Paris, raising awareness of climate crisis. As of course they're talking about ending poverty as their mission, but they're bringing people together who actually see the benefit of decreasing carbon emissions because it's about humanity. It's not about profit margins. So you try to, data show that people stay with companies longer who have an actual mission bigger than themselves. And so when you start to integrate that into the company's infrastructure, the mission and the climate, you'll see higher retention, and also you'll see just a greater bottom line. And so I think it's important that people recognize the role that plays when you're trying to convince someone of change, as you mentioned.
Yeah, absolutely. Okay, so moving on to your second master's, you got a master's of arts and sustainability at Wake
Did.
Forest University. So you spoke a little bit about like you had more of a focus now on environmental justice, environmental racism.
Mhm.
What was the thought process of like, okay, let me go and get this master's of arts and sustainability?
Yeah, so I mentioned earlier Dr. Stan Myberg, and he was on the regional administrators for the Environmental Protection Agency for several years. He had a fantastic reputation, and he valued public health. He said, "You know what, Crystal, we don't have a public health perspective in this cohort. We need your voice." And so I wanted to bring a perspective that sustainability spaces don't usually talk about. You're talking about Mother Earth. You're talking about green space, green infrastructural solutions. You're talking about a host of things that are important, but not really integrating humanity in that space. And a lot of those things, to be quite honest with you, Amari, sustainability is very privileged. If you have the time to think about that, then you're not suffering. I mean, the reality is, so I wanted to bring perspective in that space. Like, you want people to go buy solar panels, but can they afford that? Who's going to sustain it? What are the resources to get those things? So I wanted to bring that perspective of public health in terms of equity, so that everyone can be involved with sustainability, because everyone can't afford to buy an electric vehicle right now. But what other things can they do that can actually contribute to decreasing the climate crisis? And so that's why I was really compelled to go. And I also didn't understand the language, like I mentioned earlier, and wanted to be challenged on my end, because I kind of knew about public health. I was maxed out, but I just needed something to challenge my thinking, to stretch my reach.
That's really important, and I think it's important from any perspective, like regardless of like if you're going into a Masters of Sustainability program or Masters of Public Health program, just having varied perspectives coming into the program is important to share with that cohort and to give this other like as I say, perspective around the issues and the things that we're talking about. Because many times, as you said, people aren't thinking about it in the same way that a public health professional is thinking about it. And I guess the same way goes, like, if you're a sustainability professional, you're not thinking about it the same way as a public health professional isn't
That's
thinking
right.
about it the same way as a sustainability professional. So like
That's
those
right.
intersections and those learnings are just so important.
They are, Mari, and I'll say this: it was not always easy. There was some times we had some heated debates in the classroom with certain faculty. And I mean, this particular faculty was known for being controversial. I know how to get along with him because I can appreciate his perspective, but it also helped me understand the value of understanding the opponent's perspective, because you cannot win over anyone without understanding their perspective. And that's one of the biggest, I think, gaps in a lot of people who are trying to make change. They don't want to understand the opposition. So that helped me understand what corporate companies were thinking, what the right was thinking, what the left was thinking, right? So that I can go in and understand and use the right terminology. Because when I took a trip for one of my classes, we took a trip, Amari, to the Outer Banks for a class. We stayed over the weekend. It was an actual class. And we had to change our language. We couldn't use climate change. We had to use climate resilience, because climate change was triggering for those living on the beach. But climate resilience was optimistic about what the impending danger was. So you don't learn that unless you actually get exposed to those experiences.
Yeah, I love that. I love that, and I think that that's important, and something that I think we have an issue with as a society is just like people are becoming more in the margins and more in an echo chamber and not allowing themselves to listen to the opposition and the other side. And I think in that there's a loss in being able to understand, okay, what are those dynamics and those beliefs that you have, and and I think, like, to that question is like, what do I have to present to you for you to change those underlying beliefs? And you
Mm-hmm.
can only understand that if you have that conversation with that person to understand where they're coming from this from. And then in future conversations, like, I don't think you should go into any conversation trying to change anyone's mind,
Exactly.
especially in the first conversation. It's not going to go
Exactly.
well. I think you have to go to that first conversation trying to just understand.
That's
And
right.
then from there, you can understand, okay, this is why they're thinking about this way. And then you can present different evidence to them that would fundamentally shift how they think about things, because they understand, because then they're able to what they value, and you can present
Mm-hmm.
that information in
Mm-hmm.
a way that is going to help them to think about this differently, which I think is something that
That's
we need
awesome.
more in this world, not only just in public health, but
Absolutely.
worldwide.
I agree. God
Yeah.
knows I agree. I think that's one of the biggest limitations of the DEI space I've observed, Amari. People are going in expecting you to change your mind about the history of this country, but that's people's value systems. And so you have to tread lightly while understanding there's a lot of oppressive experiences that has happened, but people have to be strategic in how they approach a value system with just how you describe. So I appreciate you mentioned that.
Yeah, no one likes to be shouted at and told that,
Right.
hey, your beliefs are wrong. No one
Right.
likes
Exactly.
that. No matter where you
Exactly.
are. Right. So that were there any other takeaways from your Masters of Arts and Sustainability program? You said that you went in there to learn the language as well as to learn more about environmental racism.
One of my favorite classes was a class I took in the law school by Dr. Scott Shang. He's fantastic. He has a law clinic where he gives pro bono advice to those who have impending lawsuits for those who can't afford dealing with environmental injustices. And so I learned the impact of policy, environmental law, and I went in open minded about that. And so the takeaway is go in open minded about any and everything. There's always a connection to public health. Systems thinking and feedback loops are important to learn about as it relates to outcomes. And so I was one of the very few people of color in my cohort. So I had to be very open to that. And I looked at it as an exercise of, well, Crystal, where you're going in this space, you're gonna have to get used to this. And I'm okay with that. So being open to your environment, not looking like you're not welcome, it's just an opportunity to stretch yourself and prepare yourself for where you're going. So that's a takeaway for me.
Yeah, appreciate that. And you're a nationally board certified health and wellness coach and training facilitator. Talk about your interest in becoming one of these, as well as what is the benefit of this.
Gosh, Amari, why am I doing so much? This is ridiculous. No, so that started at UNC Greensboro, and I actually used to provide national trainings with my colleagues at UNC Greensboro. What I did with that was I did trainings, and I also was part-time at Wake Forest before I got to Wake Forest at the Thrive Wellness Center. So I was a health coach on campus for students part-time. And so that's what I did with that. I'm still certified now. I've been invited by a few national organizations to join their full time, but I haven't obviously accepted those. And so there's been great opportunities out of that. But I think what's great about being a health coach is that when you're trying to get people to change behaviors in public health, you learn how to communicate better. You empower your patients to make change and not coming from you. That's one of the biggest mistakes that I see in the healthcare system or the health education is that you're telling people what to do, but you're not empowering them and giving them opportunities to devise their own solutions. The system has created it where they ask you, what do I do? But scientifically speaking, the data show that health coaching is the best approach to get people to change their behavior. So that's been a fantastic takeaway. I actually use health coaching in my life. Sometimes I health coach my husband and he hates it, but it certainly helps with communicating and making change. So how does that make you feel? He's like, oh my God. But it certainly helps when it comes to communication. My communication has been tremendously better because of that experience.
Yeah, that's important. And I think communication is a skill that we can always take, we can always learn, we can always build on. And it is fundamental in this week, especially when you're having conversations with people from varied backgrounds.
That's right. You're exactly right.
You were a community engagement and research support at the Anna Julia Cooper Center. So how do you come across that and what did you do in it?
Yeah, great.
Do you currently work in this position as well?
Yeah, we're at a bit of a standstill, but I think at the time when I was there, I was a graduate student in the sustainability program at Wake Forest. And I took a class with Dr. Melissa Harris Perry, who you may or may not know. She's a nationally renowned journalist that used to work for MSNBC. She recently was on The Takeaway with her own radio show. She was a host and managing director there, I believe. Managing host. So I did an independent study with her, and her and I connected, and we had a great relationship. And she ended up relaunching her Anna Julia Cooper Center during the pandemic. So I became like an assistant executive, an assistant producer under her. And we produced live shows when it went during the election, and we brought people all across the world and we talked about everything, all of her direct connections. And that was fantastic. So I worked with her in that position there at the time. And then that actually led me to an opportunity to co-teach with her when I got to Wake Forest, which I'll talk about a little bit later. But yes, the Anna Julia Cooper Center is still up and running. I think, but they also had a system check podcast that launched out of that during the pandemic. So I worked with her on that particular podcast to do the producing with her as just like I'm not bringing any skill set here, but she's helping me, she's training me. Chris will do this, do that, so me and one of my colleagues there as well was working with me, and Jamie Crockett. And so we worked together in that. So that was fantastic. I never thought I'd do anything in production, Omari. I don't envy you. I admire, well, I don't envy you, but I also admire you because you do fantastic work. But now I kind of know, it's like, oh my God, this is serious. But yeah, so that's how that happened.
Yeah, it definitely is no easy feat. People see the output of it, but there's a lot of back end stuff that
yeah,
goes on.
especially me. I have to repeat. Can we do that
again? That's no problem. That's no problem at all. And then you're currently an assistant professor of the practice in the Department of Health and Exercise Science at Wake Forest University. How do you come across this position and what do you do in it?
Yeah, so I was at UNCG at the time when I saw this, and I was drawn to it because it was an opportunity to create a minor in public health in the department. And I currently teach lifestyles and health, basic foundational course, but I integrate public health in my class. I spend a lot of my time teaching those sections, to be honest with you. And I do a host of other service with the university, but that's what I'm primarily teaching. I've co-taught a class called Race, Sustainability, and Environmental Justice with Dr. Melissa Harris Perry, who is there in their political science department. And so I'll kind of co-teach with people here and there. I've done several guest lectures across the university and of course, other universities in North Carolina and abroad. But that's where I'm at right now in that space. But I am working to bring a minor in public health to our department. I will say I also just launched a medical terminology course here. It never been offered to Wake Forest before in the history. And so I'm teaching that right now during the summer with 2 other colleagues. And so those are a few things I'm doing there, again, serving in various capacities as service is needed. And so, yeah, that's, and I absolutely have enjoyed Wake Forest, not only because I'm a graduate, but because our motto is actually pro humanitate. So we put humanity at the center of everything. And sustainability is huge on campus. And so we have a center for energy, environment and sustainability. I probably got that order switched, but the CEASE Center, we call them. Fantastic. I actually funded my studies in St. Vincent and the Grenadines, which I'll be heading back this summer for 2 weeks to do research in disaster preparedness. So that's what I'm doing at Wake Forest, and it has been an incredible opportunity.
That's amazing. I'm yet to make it to St. Vincent because I'm from Trinidad, and I don't know if you're aware. I think you're based in Jamaica or have
That's
Jamaican
right.
roots. Am I right? Okay.
That's exactly right. Both of my entire family's from Jamaica. We were just in Negril, but they're from Kingston, but really from Clarendon area in Jamaica. But you're from Trinidad. My sister's dad is from Trinidad. Yeah. Okay. That's all the way. I see Trinidad and Tobago from St. Vincent. We can see it from the main island.
That's actually probably true.
That's awesome. I love that.
Yeah, me too. I love the Caribbean connection.
Yes, hence the mango consulting.
Hey, mangoes are definitely my favorite fruit.
Yes. Yes.
100%. So I wanted to ask more about teaching because earlier on when you said that you began teaching at UNCG and now you're an assistant professor and you said you're building out this medical terminology course, what are if someone's getting into teaching, what types of advice would you give them becoming like an assistant professor or in any type of teaching or professor role?
Yeah. So first I'll say I recently received the promotion, Amari. I'm associate now, starting in May. So I'm like, oh my God, I've never had a promotion in my life. So, but I will say this, I would encourage people to land like I did at Central, North Carolina Central, get an adjunct position. get your feet wet first to see if you even like teaching, because teaching isn't for everyone, right? Get you some experience. It also looks great on your resume. A second thing is know that you don't have to have a doctorate to teach. I'm a professor of the practice, which simply means I'm not on the tenure track, but I am noted as a professional in my field. And so they hire me as an expert to teach as a teaching professional. So people think you have to have a doctorate and you do not. There are some benefits to having your doctorate. I encourage those who would like to get it, but it's not required. Also, those like a Nicole Hannah Jones don't have a doctorate, but she has like a Pulitzer Prize, but she's got tenure without it. You know what I mean? So there's a balance with, you can be amazing without a doctorate and get tenure. So it depends on what your interests are. Also, I would, if you're trying to apply to an actual job to be a faculty member, here's some really good advice. Figure out what are you bringing to the department that isn't already there. What's your focus? No one in my department is doing environmental justice right now, right? Not that it isn't happening across the university, but in my particular department. Because as I've been on several search committees, I've hired people, I've been part of faculty who've hired others, and we always want to know, oh, well, what are they bringing? Oh, or they can work with so-and-so. It's usually, how do you fit into the grand scheme of the department? Are you bringing a new perspective, or are you actually supporting the current research being done? Makes a huge difference. So embracing your difference is huge. And I'll say, as a consultant, don't wait to start. Have a plan, create an LLC, know your value, right? When people ask you, what do you charge? Charge what you charge, and be okay with that. And if they say no, it's all right. As long as you know that that comes with the territory. And lastly, just dream big. You don't have to be the expert on all things. You hire a team to do the things you don't know. And so remember that. I used to be so paralyzed, Amari, when I was starting my business. I don't know everything. In fact, I didn't even want to be a professor because I didn't know how to do stats. But when I learned, Omar, that they hire statisticians to do all the work with their research, I said, man, game over. So I realized that's just the model in business. And a lot of billionaires will tell you the same thing, that, listen, if the key to success is having a great team. So same with you. Subcontract out whenever you can, bring people to the table. In fact, I'm applying for a project now, and I'm brought 3 young ladies who I've never worked with, and we're going in all together on this opportunity that could be life-changing potentially, right? So it's just, you have to think big and also be strategic. So those are my advice about that, in terms of being a professor or a consultant.
Yeah, that's definitely some key insights there, and definitely like leaning on your strengths and finding people who are strong in the things that you're not as strong as, so you don't have to learn all those things. Because I think a lot of times there's a time course of ignorance in learning
Mm-hmm.
something that can be pushed on to someone else who's already an expert in that. And I wanted to ask, so you said that you're going to be working with a couple new co-consultants. How would you recommend, like, someone who is interested in doing consulting work reach out to consultants that are currently working, or like how would you advise them going around that situation?
Yeah, I have to give one of my friends a shout out here, Dr. Uche Blackstock. She was a physician out of Harvard. She's retired now. She has her own business. I believe she follows you, Amari. Honestly, she's fond of your podcast. But she introduced me to 2 young ladies. One lady who connected me to someone else who is now working with me. So reaching out to folks, telling them about what you're doing, letting them know what your needs are, based on having the relationship you have, and they'll likely genuinely connect you. Uche did a share of something I did, and her one share on her profile, because she has so many followers,
Yeah,
brought
she does.
opportunities to me. You know what I mean? I text her like, oh my God, thank you for changing my life. But, just networking genuinely, I'm careful with that word, because networking can be very transactional. But meet people, learn people, see what you can do for them, and just really figure out how you can be a force together. And people will generally reach out. I had a person I recently connect with reached out to me through DMs on Instagram. And now we're going to probably do a whole bunch of work together, based on just being open. People are watching you. People want to do, you know what I mean? So being open, and just sharing, don't be afraid to have your elevator speech ready at all times. So I'd say that.
Yeah, you should have your elevator speech ready at all times.
Yes.
But yeah, definitely appreciate that advice. and insight. So you're currently consulting
Mhm.
with the Robert Wood Johnson Foundation,
I
which I think
am.
many people in public health think is like the apex of many organizations out there
Yeah,
doing public health work. So can you talk more about maybe the work that you do? I don't know if you're able to
sure.
disclose it, or like how you
Absolutely.
got involved in this work.
Yeah, great question. So I'm also part of the Greensboro Health Disparities Collaborative, which is out of Greensboro. Their focus is on systemic racism, and we received a grant from NIH, which was about I think $1.5 million a couple years ago. It was a 5-year grant in collaboration with UNC and several other partners in the community. Particularly, it was a community-based participatory research grant. There was a gap between Black and white breast and lung cancer treatment completion rates in the hospitals. So we launched the ACCURE project, the Accountability Through Cancer Care Through Undering Racism and Equity. We call it the ACCURE project. Because of our success, because our intervention changed the system, we put a real-time registry inside the hospital, which actually fundamentally closed the gap between Black and white treatment completion rates. We go all over the country now to present those findings, led us to being connected with Robert Wood Johnson. He said, they're like, wow, wait a minute. We want to have one of your representations on our on our um, on our consortium. And so I'd say Rakaya Yerby reached out to me from the Institute of Healing, Justice, and Equity for representation from the Greensboro Health Disparities Collaborative to represent on the collaborative, because the collaborative is focused on two focuses. And I don't even know if I have it written in my mind what they're called, but one's focused on policy, one's focused on health care, and they wanted to know how to make their funding sources and RFPs or requests for proposals more equitable, and to make sure that those who are applying for the funds are addressing systemic inequities and systemic racism. So they hired about 50, they appointed about 15 of us across the country. And I have to give a shout out to Dr. Brian Smedley, one of my friends there. He's serving alongside me there. And we give feedback to Robert Wood Johnson on how they can make their funding opportunity more equitable. So in collaboration with the Institute for Healing and Justice and Equity, the Anti-Racism Consortium, they all provide a framework of how programs should enhance each other and advise programs and outputs. So the goal at the end of the day for the consortium is, how can Robert Wood Johnson be equitable in their funding sources and who they fund? And we meet every week for the past year. And we are meeting with Robert Wood Johnson, who comes occasionally, and we provide recommendations. We create a report. We're doing publications and all of that for them to apply to their infrastructural processes.
Love that. I think that's important, because a lot of times you don't even think about what is the barriers that are inherently here because of how we have those applications or
That's
those
right.
funding opportunities and different things like that. So being intentional about it, I think, is something that the funding will need to do more of. And I know like the conversation is happening more often than not now. And I think it's just to continue that conversation. And when we have leaders like Robert Wood Johnson Foundation thinking about this and making those moves, I think a lot of other people are watching
Mm-hmm.
and are going to continue to do that type of work, which is important. So thank you on that side as well.
Absolutely. Yeah, I'm glad to be part of that space.
Yeah, absolutely. So Crystal, before I move you on to the Furious Five, I would like to ask you, where would you like to see yourself in the future?
That's a great question. I think I'm going to always be teaching to some capacity, but I would love to serve as a global consultant providing insight to companies and their impact on the climate crisis. I want to be the go-to person to talk with them about how their impact is affecting health disparities and widening the health disparities gap and even the wealth gap, but really the health disparities gap. I see myself being a leader in that space, particularly sustainability. And that's where I see myself at this point. And of course, teaching. I think it's important to teach the next generation how to do the things that you want to do. And I see myself doing that. That's where I am with that, Mari. It's an excellent question. It's always a tough question because, my brain goes everywhere every day. But I absolutely, like I said, a global citizen, for example, that'd be an amazing opportunity, right? To really get at the center of what it's about when it comes to humanity. So that's where I'm at.
Okay, love it, and we look forward to seeing you take on that path and I guess trailblaze down that path as well, because we need more of that. We need more people like you in these kind of spaces.
Thank you. Likewise, Mari. I appreciate that.
Yeah, my pleasure. So moving on to the Furious Five, the 5 questions I ask all guests. Number 1, what advice would you give to a student trying to pursue a career in public health?
Oh, this is a great question. So, the first thing that comes to my mind, Omar, I tell everybody, your zip code is a bigger predictor of your health outcome than your genetic code. All right. And so, the advice I would have is do not focus on behaviors. While this plays a role, the systems plays a much larger role. So, examine the systems and the role that they play. When you look at healthcare, they call it health disparities. When you look at banking, they call it the wealth gap. When you look at education, they call it the achievement gap. They call the judiciary as a disproportionate minority contact. There's always a label in every system of the inequities. So examine what those inequities are at the systemic level, and you'll really get ahead in making an actual sustainable impact. I'm really always center the environment. Look at how the role of the environment plays as it relates to health outcomes. Because if you cannot possibly have a conversation without health disparities and not include the environment. All right. And just lastly, I would say know that access to healthcare is not enough. You can have access to healthcare and have a different treatment based on how you present yourself and your identity. So know that the social determinants of health, while they're insightful, they're not there's more to the picture, right? And that's because the Acure project proved that.
Yeah, appreciate that. Number 2, if you are talking to someone wanting to get into your position, what advice would you give them?
I kind of alluded to this a little bit earlier about the associate professor aspect, but again, get some experience. I'd say, what do you offer that's unique to the table? And again, as a consultant, just don't wait to start. Jump right in, start your LLC, know your value. And I often say, then add tax to your value because it's going to cost a lot more. It's going to be different for you when you're a person of color navigating this space than our white counterparts. That's the reality. And dream big. It's really important that we do that.
Yeah, love that. And congratulations on the promotion, by the way.
Thank you, Mari. I appreciate that. It's effective July. That's what they say. I was like, well, I'm telling everybody.
Soon to come promotion. That's dope. That's dope.
Right.
Number 3, what's something you're working on improving in your life right now?
Yeah, you know what, Omari? I'm learning to only accept opportunities that align with my future goals. Because, like yourself and others who are visible and high demand, people are always going to ask you to do something. And while it's an amazing opportunity, if it doesn't align with your goals, I'm learning personally just to say no or just think about it before anxiously saying yes and not looking at it as a lost opportunity of getting ahead, but rather an opportunity to focus on your goals of where you really want to go. I'd also say going after opportunities scared. Go in scared. You're not supposed to know what you're doing all the time. So that's totally fine. I'll say I'm learning that because when you're a planner, you often don't do what you don't know what to do, right? So I'm learning to just dive in, right? That's how I learned. That's how you learn to swim. You learn to do a lot of things, right? And consistency. I'm learning to be consistent, Omari. We're talking about if it's getting up the same time every day, having a structure, it's super important. And just in general, lastly, I'll say getting up earlier. I'm a night owl, so early mornings are like death. I'm like, what is happening in the world right now? What are we doing that cannot wait? But I'm learning to get up earlier because I get more done. And I discovered a funny thing, Omari. I was like, why don't I want to get up early? And I realized because I didn't realize there was something called naps that take place. So if I was afraid that I would be too tired, I was like, oh, there's something called naps. I can take those.
Right.
Bet. Let's get up early now. You know what I mean? So I just often overthink. So I'm also learning just to not overthink. Some opportunities, you just got to go for it. And you'll figure it out when you get there within reason. You know what I mean? So yeah, so that is something I'm working on right now.
Okay. Number 4, professionally, do you recommend anything?
Yeah, I have a few. So some books. I'd say The Color of Law by Richard Rothstein is great. I actually have them here, Omar, if you want to, if it would help to have a visual. But The Color of Law, look at me for like, I'm such a teacher. The Color of Law is one opportunity by Richard Rothstein. The Heat Wave, which is by Eric Kleinenberg. I had an opportunity to speak with him in my class in undergrad, which was, in the master's program, which is fantastic. The New Jim Crow. You probably know about this book. Michelle Alexander. If you want to learn about the systems and the role that mass incarceration plays, that's fantastic. I have 2 more here. Bias by Jennifer Eben. I'm sorry. Eberhardt, yes. So Bias by Jennifer Eberhardt. Dr. Jennifer Eberhardt is a fantastic read. And lastly, because the Greensboro Health Disparities Collaborative contributed a chapter to this book, Racism, Science and Tools for the Public Health Professional. So this is a fantastic book for public health professionals, of course, which is edited by Dr. Chandra Ford, Dr. Derek Griffith, Dr. Dr. Marina Bruth, and Dr. Keon Gilbert. All fantastic scholars in the field of public health. And there's a host of chapters from brilliant minds across the country, maybe even the world, in public health, giving you recommendations in that book. And so that's awesome. So those are the books. As for podcasts, Sustainability Defined is great. That's the only one I've been listening to, really. That's pretty cool. I love the personalities up there. So Sustainability Defined. And lastly, webinars. So Advancing Racial Equity, Environmental Justice was on the American Public Health Association. I happen to moderate that one. And if you are a National Wellness Institute member, I'm currently a senior fellow there now. They did a webinar. I did a webinar called At the Intersection of Environmental Racism, Sustainability, and Wellbeing. Even if you don't watch my webinar, they have a host of other webinars that are great. And I'll say one last thing. There's a policy brief because I am an environment section governing counselor for the American Public Health Association. We just passed a policy called Advancing Environmental Health and Justice, a call for assessment and oversight of healthcare waste. So if you're interested in policy briefs, understanding what it means for medical waste and sustainability and how it may be an environmental justice issue, fantastic policy brief to read. So that's what I got, Mark. That's a bit of overload, but hopefully they got a few.
Yeah, I definitely love that. And if you all are interested, you could definitely rewind and check those out. Or you can go to the show notes page, which will be linked below, and click on it, and it will have all those resources linked out there for you to check out. But yeah, I appreciate you sharing those. Some of those I have not heard before, and some of those I am aware of.
And Omari, I have one more recommendation for a book. It's Legacy of a Black Physician Reckons with Racism in Medicine by Dr. Uche Blackstock. She just published that. It's actually on pre-order. So get your copy because it's fantastic. Definitely have to put a shout out for her because she's amazing. So that'd be an amazing book to read.
Okay, awesome. Thank you for also including that. And yeah, she is awesome. When she shared one of my Instagram posts like a couple months ago, I almost fainted.
I told her I was coming on the podcast. She said, I said, hey, Uche, I'm gonna shout your book out. She's like, well, what podcast? I was like, have you heard of the public health millennial? She's like, oh my God, I actually follow them. I was like, yeah. I was like, now I'm definitely going now. But nonetheless, she does admire your work. So that's awesome.
Love that. Love that. That means a lot. Okay. Awesome. Well, last but not least, where can people connect with you?
Yeah. So I'm on LinkedIn. I'm pretty active up there. So you just look for Crystal Dixon. I am wearing green. There's a few of me out there, apparently. If you're on Twitter, I'm at Miss_Dixon9. IG, I'm Prof, PROF _Crystal Dixon. And if you want to follow Mango Consulting, I'm on IG as well, Mango Consulting Company. And lastly, my website is mangoconsultingcompany.com. I want to add one more thing, Omari, about some research I'm currently doing at Wake Forest. I recently received some funding from our Leadership and Character grant at Wake Forest. And I mentioned earlier, my colleagues and I are doing some research in St. Vincent and the Grenadines to address disaster preparedness impacting local residents. They recently had a volcano, dengue fever, COVID-19, and a host of other things. And so we're trying to explore ways to be more efficient in how they respond to disasters, which is awesome. And lastly, I'm working on a grant with NASA right now and UNC Wilmington, and we're providing green infrastructural solutions to address health disparities in flooding in the coast. As you know, North Carolina has a lot of hurricanes, and so there are a lot of vulnerable Black and Brown communities, low wealth, that are more susceptible to flooding. So we're trying to provide recommendations for the county and city to prevent that going forward. So we're actively involved with that study right now. That project.
That's awesome. Yeah. Thank you for that work. And just to add like a little bit to that, because I do work with some of those groups that are in those regions that flood when they are like a lot of rains and stuff like that. It is like the systems behind that as well, because you know that the white people took all the high land and they gave the low lying land to the Black folks and other folks, and that has created systemic issues that we see today. So I just wanted to point that out as well.
Speaking my language, Amar, you're right on it. That's exactly right. That's the systemic racism, the redlining we're talking about. That book, The Color of Law, talks about redlining and how it was established, right? You probably are very familiar with the history in this country. And us being with Caribbean background, it's news to us, but it's also understandable with the role that race plays here, whereas class is, back home, right? And so it's really interesting you mentioned that, because it is, you're apt, and that's the systemic racism we're fighting. That is why the systems and policies are responsible for the inequities we're fighting, and not people's individual behaviors.
Yeah, absolutely. Absolutely. Well, thank you so much, Crystal, for coming on and sharing your
Thank
story and
you.
your insights. This was a lot of fun, and I learned a lot of new things, and I'm glad that we were able to connect.
Likewise, Amari, thank you again for the invite, and I'm looking forward to your product and what you're going to have. And let me know if you need anything from me. If you need a picture, bio, whatever, just let me know.
Will do. Housekeeping items, everyone. Thank you all so much for watching or listening to this. Be sure to subscribe. That is one way that you can support this podcast, support the Public Health Millennial. So be sure to subscribe, to leave a like if you're watching this on YouTube, leave a review on any podcast platform, and share it with a friend. That really helps the show get out to people. So I really appreciate you all. Peace.
Peace.